All right. My name is Walter Carpenter. I am 62 years old and live in the city of Montpelier, Vermont. Most everyone who knows me inside and outside this building knows that I am an activist for universal primary care. While I would like to see us take Act 48 off the shelf, shine it up, and implement it like we should, I am fighting for UPC. I would like to ask everyone in this well, and for that matter beyond it, a question. I apologize to the more veteran members of these committees for regurgitating a story they may have heard before. How much are you worth? In other words, how much would you spend to save your life? Is it $20,000, $40,000, $80,000, $200,000? You have no insurance, you need the operation, or you will certainly die in the excessively near future. In 21st century America, in 21st century Vermont, I had to make this choice. This dreadful decision could easily have been prevented with timely access to a primary care physician. When the disease first manifested itself, I was working for a Vermont company and surprisingly even had it. Yet, like so many companies, this company was owned by a parent and we had to subordinate ourselves to it. The parent suddenly changed health insurers just as the symptoms were coming on, and in one stroke, my primary care physician was pushed into that void called out of network. Sure, I could visit this doctor, but only if I plunked down the hundreds of dollars of the uninsured rate. The new insurer lacked primary care providers in Vermont. The nearest one was probably in St. Johnsbury, about 60 miles away. I had to struggle to find a primary care physician, and when I finally did, it was almost too late, and I ultimately had a price on my life. I understand all the bizarre complications to UPC, difficulties that often seem more complex than the Apollo moon landings. We spend $6 billion and more annually for healthcare now. Some $2 million of that goes to just one healthcare CEO. We can do UPC. We did it as the first state in the Western world of the 18th century to abolish slavery. A sign out front here testifies to this state's courage in being the first to defy traditional norms regarding gay, lesbian marriage. We did it this week with marijuana. We can pass S53, H248. If we do, when we do, no Vermonter will ever again have to ultimately choose between medical debt forever or death for lack of a primary care physician.